Kati, when you come for antenatal, compared to get like the things you should be asking the doctor. There's also a very interesting part. Was that which one?
Which one?
Akwe picture.
6.
Hello, how are you? Welcome back to Vibes with Dr. Ruth Grace. We're here for the He for She podcast. And wembate mwalabi sessions abaddewo bambi tugenda bako bamigo kati leero. But other than that, welcome. And today we're going to be talking about what men need to know about pregnancy. Well, is it even important for men to know about pregnancy, and what should they be doing anyway? And in the house today, we have a very interesting gentleman. And he'll be introducing himself because, I already have a crush and whatever, all those things. Okay, it's a camera crush. I need to make that clear on some of the things. Yeah, a camera crush. And yeah, he will introduce himself. And yes, you are welcome to Vibes with Dr. Ruth Grace today.
Well, ladies and gentlemen, good afternoon, good evening, good morning, wherever you will be watching this from.
Yeah.
My name is Tugume Wycliffe, also known as Wyke Bender, musician, and probably this is what the people want to hear. My name is Wyke Bender, the boy, so tender fast on every girl's agenda kwa mziki situndavyo, and I'm straight from Uganda.
Okay, in the podcast with Ruth Grace.
And the podcast with Ruth Grace at Agenda.
Atagenda. Kale kati Wyke.
Yeah.
Wycliffe, should I just learn that? Okay.
Mm-hmm.
Wanted to find out.
Yeah.
There's this hot topic about men and pregnancy. Abalabagamba. Whatever happens with the woman, she's pregnant, it will be bien. Do you think that is right? Let's start off this conversation.
This conversation is a very fickle one.
Yes.
When you think about it in depth. But there's so many kinds of men, especially in this generation.
Different kinds of men. Yes.
Yeah. And there are softies who women love a lot now because they're touchy-feely and they're very, they're in touch with their emotions.
Yes.
And there are still those who are a bit toxic. That's the term they use today.
Yeah.
But it's more masculine. For me, is the term I use.
Yes.
And they're not touchy-feely, but they're the responsible ones.
Yes.
They make things happen.
And they are they present?
They are present,
Okay.
but not so emotionally present.
Oh, emotionally absent.
Yes.
Okay.
But financially, logic.
Yes.
And women don't like a lot of logic sometimes, not in that situation anyway. When they are pregnant.
There's something called pregnancy brain. It's real, man.
What is that?
It's like a woman just keeps on forgetting. And she's like,
Are you for real?
yes. And then that thing like just tips off me like, I am telling this lady, she's not understanding what I'm saying. And then they usually have this statement of like, ever since she got pregnant, her brain left with her. But like it's really off when they say that.
Yeah.
I'm going to drag you a little bit into the antenatal situation.
Yeah.
What we usually see and why we think like you have described the different types of men. We also see the different types of men when we're doctors and we are in the antenatal clinic or when we're in labor ward.
Yeah.
And he's always there. He even wants to be involved. Other people are like, oh my God, even holds a handbag. Okay? That's like I don't know if that's like the emotional part.
Yeah.
And then there's like this other man that is going to come and just sit and just wait for everything to get done. But he's there. He has come. Yeah. Then there's the other guy who is just financially available, but physically.
What do they need?
What do they need? Bagala scan. Bagala search it. Okay,
Yeah.
fine. And that will be sorted. I don't know what I cannot prescribe what man a man should have. What man a woman should have when they are pregnant or when they're going to give birth. But one thing I would say that it is good to be present.
I believe so.
Yes.
Especially with the modern day and how, we come from different paths as human beings.
Yes.
And then we meet and then we create or procreate, whatever the word is.
Yeah.
And create a baby together. You'll get pregnant. And I was
create a baby together.
Abasajja
basinga ekitiibwa kimanyi.
It's together.
Yeah, they don't know that together.
Is the key word.
I always say it takes two to tango.
I agree.
A woman just doesn't get pregnant out of the blue. Like, what? And the first thing the woman does when she is pregnant is call the guy. Like, I am pregnant. She's looking for a validation.
Yeah. That we are pregnant.
that we are pregnant.
Yeah.
Once the guy's like, she's like, shit.
Now, and you know what's tricky?
Yes.
And I want to speak to men on this point. Is that that phone call or that meeting where that
Yes.
word comes out of a woman's mouth is a very dangerous point. You have to be careful what you say.
Exactly.
You could send a woman into depression and she could lose a lot, even her life.
Yes.
You could or create something that is memorable in her mind forever.
That's
because
true.
it's a very slippery ground. And I think if you called me and you told me, Wycliffe, I am pregnant, cold keyword, meaning you're not there with me physically.
Exactly. Yeah.
I want to say, first of all, congratulations.
Uh-huh.
It depends on the relationship, of course.
Depends on the relationship.
There's also when you're really in a relationship with this
Yes.
woman.
Uh-huh.
So I want to speak to the men that are in proper relationships. I am
Yes.
with this lady. We did not meet.
What if he decides then when she's pregnant that he's now in a relationship with the woman? Is that a possibility? I'm really
Yeah,
just
after
asking
she's
for the
gotten
women.
pregnant,
Yes.
that's a good man.
Huh?
Yeah,
Okay.
the one who says you carry my baby, then everything stops.
Okay.
That's a good man.
Okay.
So if you're in a relationship, a proper relationship, whether married or just boyfriend girlfriend, the first word that needs to come out of your mouth is of my mouth would be congratulations to us, baby.
Yeah.
You understand? Now, if mulimu ebyekiyaayi era njasooka nkugambe congratulations, then I'll do my due diligence. How pregnant are you? Like, how long have you been pregnant for?
Then I have missed my first period.
Then I say, when was the last time? When did we?
About a month ago.
If it so happens it's 2 months ago, you're 2 months pregnant, for
Yes,
example.
so possibly 2 months, yes.
And then me, the last time I was there is 3 months. Congratulations now.
Okakyuka muko.
Kajachuka mukugambo you're one. You understand?
Yeah.
But still, at the end of the day, I think they need support.
Yes.
The problem is also we have challenges. Even the women or the ladies sometimes they want this specific man.
So they're tricking business into that. And then
Yes. So you're getting
so
pregnant.
men are actually what I'm hearing from you, that men are afraid of what if it actually isn't my pregnancy?
Yeah.
So taking up a responsibility that is not yours. I think that has happened. I've had a friend who has suffered that. He kept up with a pregnancy and raised a child, I think up to the age of like 2 years, only to discover omwana si wange.
I don't know anything more painful for a man, I think.
That's sad.
Because at least 2 years is still okay because the kid doesn't, know you well,
yes.
I think.
Yeah.
Imagine a 5-year-old, 6, 7-year-old, and they're telling you this child is not yours. You've fallen in love with that boy. They have fallen in love with you. You are the father they know.
Yeah.
And then you have to walk away, or they have to leave your house.
And then you're like,
it's very, very painful.
Anyway, I wanted to now share a story in regards to like pregnancy and why checkups are important. Most times during antenatal, we tell women like you're supposed to test for things like sickle cell. Yeah. Because most times omwana waba sickle cell, we talked about that bit of like family and abana bakuze. Yeah. If a child is sick of sickle cell, it's not because it's the mother's fault or the father's fault. It's because it's the two people. So sickle cell is like it grows into it's like I usually say it's like a root that comes somewhere in the family line. So somehow,
is it possible for two people who don't have it to give birth to one that has it?
Yes.
Oh.
So what happens is that you just have like a bit of like a taint, a root that grew somewhere, and then so you carry both like a normal gene and a sickle cell gene.
Oh.
Ojukira ebintu bya gene ebyo kati obwegatta. So sometimes they move through and like they move through the family. So you find some children are born with a blood type that is called AS. So a person that has AS actually does not have anything called sickle cell disease. They're like, they're okay. They've never suffered a crisis, and normally they just live their lives and okay. So to find someone else that is also AS, they're more likely to also, now they have a 50% chance of giving birth to a child that has SS, that is sickle cell disease. Kati nosanga abakyala abasinga oba abafamilies abasinga in the sickle cell clinic, if you go to Mulago, you find that many women are deserted by men. Why?
After birth?
Yes, after birth. Because the children started falling sick about 6 months after. And the man is like, nah, this is not me. This is not our family. Bye. And the same thing also goes for the women. The women also like, I wish we knew. So we talked about that bit. I remember that a story where it was a family where the guy had 5 children. Yeah. And then when he was cancelled through and told that, no, actually the sickle cell disease happens because 2 people have to have the condition, he goes and tests himself.
To make sure.
to see, but is it really true?
Mm.
And then he finds his AA, which means that your blood type does not even have even like a root.
A chance.
Something. That means abana bavao.
Ooh.
Which is. So, but he loved his children. The children were there, and then I think they separated, but then he stayed with the children so that he just continued.
I know.
And the things about pregnancy that I think some men should know from like a doctor's perspective is that when the women come to clinic, most times they have this thing of like, when you ask them, "Edagawali means I don't know." They just say, "I don't know."
Why do they say that?
Pregnancy brain.
Oh.
Sometimes they forget. So then
So it's really a thing. People, the women forget this a lot.
Yes, they do, and especially if they have like complications with their pregnancy, it even gets worse. A complication like preeclampsia, which is hypertension in pregnancy, blood pressure has to go up.
Oh, blood pressure goes up. It's called what?
Preeclampsia.
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 Preeclampsia. Pre-eclampsia.
How clear.
Okay.
Okay, good.
Nice.
So that one. So so sometimes yes. So sometimes that actually affects the brain and makes it worse. So like someone is like with you, like 5 medicines supposed to be
This
on.
happens at what stage of pregnancy?
Usually after 5 months of pregnancy, the woman tends to get that. But it also depends. So some women that have high blood pressures before and they don't know, and then they end up getting high blood pressure during pregnancy, and it's recognized then. But it's manageable, though it's a second leading cause of death among women in Uganda.
Oh.
Yes. And what you see in clinic is that, let's say, okay, for example, a woman has preeclampsia and she comes into the clinic. If she's alone, we usually cancel them because the women come and then we tell them, okay, this is what you need to know about pregnancy. If you have a headache, if you ever feel like ulcers, so most times she's going to tell you, Nina ulcers. Then you're going to be like, guys, maybe, I don't know if guys have the guy talk and like the dad talk with other guys, and then like, no, mufunye yoko gundi, yafuna yoka syrup, mufunye yoka syrup akolechi, anywe. Then the ulcers just keep on continuing. But for us, when that ulcers in pregnancy is a sign of what? Of high blood pressure is now coming up. Or if she tells you I have a headache.
That's a good one.
Yes, and that brings me up to a point of like, if you are having a woman that is pregnant, mugobere mudwalire and find out, learn those things. Because one day she's going to wake up, tell you I have a headache. It's going to be a slight thing, and it's going to be like, or maybe you walked a lot, just calm down. And then she's going to be like, okay, because they actually seek a lot of validation when they're pregnant, because it's part of nurturing. You want to ensure that, yes, you are pregnant, your baby is there, but then you also have your baby daddy around and he's taking care of you. And women who don't have their partners in their lives, of course, it gets harder, and they sort of like rely on a friend or on a mother, if the mothers are still available, even on their dads, to have that assurance that there's someone that's going to be there to take care of me.
Emotionally.
Yes.
Psychologically.
Yeah. So now she tells you, yes, I have a headache. And this hasn't happened once or twice, it happens a lot. Mwami aleta omukyala nga yes said they're just convulsing. Like, okay, I don't know what has happened. And usually it's the neighbors who call and say, the woman is not opening that door. There's something wrong. And when they open that door, omukyala aliri wansi ali kutaka, like she already convulsed. Usually they will just know like abanga yes
it's like epilepsy.
It's like epilepsy, but it's not epilepsy. It's actually convulsing because now the high blood pressures are too high.
Okay.
So something that can happen. And then apart from just high blood pressure, it's like what will be pregnancy? And starting from the word go, did you know that a baby grows complete in the first 3 months of pregnancy?
Complete?
Yes.
Like abamazokufulu.
That is even before you even see like a bump.
That's why these people who take on abortions and stuff at that stage is very risky business for the mother as well.
Exactly, it is. And especially if it's above 3 months, now it even just gets worse. Because after 3 months, the baby is now big.
What happens? Because I'm a father of one.
Yes.
What happens to their emotions? Is it called hormonal imbalance or something? They move abalala muko. Some don't want the man around at all.
Yes.
Others want the man too much.
Yes.
Others are abusive. Others are too kind. Others are not sweet at all. You understand? So what is that? Because I think my brothers want to understand this.
I hope people will help us in the comment section and like drop down all this information. Otherwise, like, Tulina okitegeerako. Women, what do you want men to know about pregnancy? I think they should tell us and like share more.
My God.
But the pregnancy is different. And every pregnancy is also different. So waba yazala koko, it's not the same thing as like, this one will be like different, this one will be like, there's something else.
Every child with their
child. The same way like when you have a babe and she tells you, maybe like on this monthly period, like this period I feel like I want chocolate. The next one I want chicken. Next one I want about like a certain soda.
I ever bought chicken. They sent me for chicken and
Yes.
I went to KFC, I think. Bought a lot of chicken.
Yes.
And then I brought it home and they threw it in the bin.
Exactly. Because it was in a particular chicken.
and I was not warned. This is why it's important for young men who are in relationships to have friends who are older than them.
Yes.
And even your mothers to talk to you about these things. You get?
Babu
Because man, tutomera kati ovaawo ng'onyiize
naye ngomukyala
nga tomanyi na lwaki ali bwatyo.
Exactly.
Kumbe it's not high even.
So pregnancy is very interesting. It plays tricks. And Osangolumu, sometimes a woman actually will even hate herself. There's also that other part. And the thing that also keeps on coming is there's a change. And I think men should also know about this.
Yeah.
That a woman's body changes when she's pregnant.
Whoa.
And even after she's given birth, it changes.
And I am victim in that area because we like to find bodies too much.
We like find bodies.
And
then
we forget that the person you love,
yes,
unfortunately, is not going to stay the same.
Exactly.
After they've given you a beautiful baby.
Yes. They now get a new body.
And I have been teaching myself to prepare myself for that because I was poor on the first one. Yeah. But for the men out there, I think this is something we need to know.
Yes.
That they can get back to share. That's also true. Kadokita kunako kwogereko.
Sigenda kubanga abakyala tugenda bassa ate kati wetuna kwogerako we bacho. They can get back, but it takes time. It's not a snap.
Yeah.
Can actually take up to 1 year or 2 years. Because
there's breastfeeding also there.
Yes. And now when she's pregnant, a woman's we call it like the calories. Like we have to increase them. Like chaino kulia. If you've been eating a 3 meal every day, that 3 meal oyongera stacks with it.
This is when she's pregnant.
Yes.
Okay.
Now when she's breastfeeding, it's even worse. So she has to add at least 3 more snacks onto the meal that she's having. So which snacks are we talking about? They have to be sometimes they are healthy snacks. Like yogurt is a very good snack, nuts, fruits, etc. Something to keep her body going, because if she does not eat, she's just going to get dizzy and she'll fall. The interesting thing about now pregnancy that men don't know is that when a woman is pregnant, she feels full all the time, but she's hungry. So
it's the onus is on you to make sure she eats something.
And then when you bring that food, she's not going to complete it and you're going to get angry. Because you're going to give her a plate of food, and it's a struggle. And that's why antenatal is important when men come, and then I always tell men, ask the question, like ask the doctor.
This is happening at
home.
What does it mean?
And usually when I get a man into the consultation room, I'd be like, okay, the woman tells me everything about her. And I'm like, sometimes the man is going to be like, that's very important. Wagamba nti azimbi, and then you know, okay, I like ina pressure. Mchala mugamba naye
kuzimba chebigere.
No, namaso. Wangu oba wala mu mirror every day. Someone's not going to tell you that. You're not going to tell yourself that ndi mkuzimba for you just growing. Someone else is going to tell you like, maybe something has changed ko. Oba inzo kuba yanoga naye talia. So the man says, Musawo, I've bought everything, naye takola chi? Talia. And then after that we address that bit because it stresses the men out, like, oh my God, I have tried everything. She just is not eating. And then wali watching chidala echokumbida malagala. Omwana njagala abe bulungi. That is the man's perspective. Yeah. Like, take the medicines like the doctor is giving you.
The other one doesn't like taking medicine.
Thank you very much. And then during pregnancy, she's like,
patience. And I think men need to know that, man, we need a lot of patience.
Yes.
They need a lot of patience from us, the women.
Yes.
And it's that point through those 9 months whereby you feel like the doctor is telling me this. You know, men are like straightforward.
Exactly. So,
what do you want, doctor? Okay, that's what I want.
Check the medicine.
Mirundi emekolo nako esatu. Yenga gateka with that, you know, in the right time frame.
Then no
sango linga gamba today I don't feel like taking medicine.
Yes, I am.
So kuvako, you can't get mad.
But you're mad.
Your baby, but you're mad. And you have reason to be mad.
And then you're like, she wants to kill my baby.
and when you say that to her, you can
Yes.
send her into a very bad place.
Exactly.
Because
And
she
she
loves
just
her
tips
baby
off.
too, you know. So men require a lot of emotional intelligence during this time, I
Yes.
think.
And then also
More than
a
even
little bit of
women.
like how to talk to her.
Mm,
So like Tommy Yombesa. But
mm,
like maybe a different way. The same way like when you say the bit of like congratulations or like
Yeah.
you're pregnant, etc. Like a very good way to start off of a phone call of hi, I'm
Mm.
pregnant. The congratulations
Yeah.
part is very important. A bit of like, okay, fine, we wanted this. Let's do it together.
Mm.
That's a different way from saying, Dr. Yagambie, no.
Mm.
And it also affects us when some of our doctor colleagues like have pregnant wives, which is even worse.
Aye.
Their wives baba goba bagamba oyo mujje mu room kubanga
Ngate.
afuuka omusawo nerabira okubeera taata
Aye.
bwe kiri
Enkofiira yambala nkyamu at that time.
aba yambala kyamaawo kati aba alina
Mm.
okugjako emu nagala kati omanyi nti nedda I've removed the coat and put it the other side.
Yeah.
Kati when you come for antenatal try to get kugundi like the things you should be asking the doctor. There's also a very interesting part. Mboza which one?
Which one?
Okwepicha.
6.
Akantu
Kakulu.
ako kakulu wayo kabuuzizaako ko. Or you just ask the guys.
Kanyumirwa.
Why
In the sense that in the sense that
yes.
I think again I want you to help because when your woman is pregnant,
Yes.
let's say you're used to having sex once a week at
Mhm.
least or twice.
Yes.
Yeah.
Mm.
And now probably in the first 2 months or 3 months she's the same size, there's no difference.
Mhm.
Maybe there's some hormonal things.
Yes.
But she desires sex I
Yes.
think as well,
Mhm.
just as much as you do.
Mm.
What stage does it demand a man to slow down on his desires for
Okay.
sex, you know, with that pregnant wife or woman?
So we start from the pregnancy and then after pregnancy.
Mm.
So during pregnancy, you can have sex how much you want.
Hey.
Yes.
At any stage of the
At
9
any
months,
stage of the pregnancy, abasajja abasinga batera kutya ki mbuza batya ki omanyi nti if you then you
zimbando z'omwana ogenda kumuwa.
wegera kyennyini kye boogera omwana ogenda mukola.
Because in that position ombanguza, are you okay?
Are you okay?
Tugende mu maaso.
Tugende mu maaso.
You understand?
Good.
Naye ng'oli
Olabakogambyako.
abagamba genda mu maaso.
Olaba kogambyako.
Yeah.
Aka conversation. It's important. Now some people keep quiet. Tamanyi gamba muntu nti are you comfortable and you feel awkward. Then the
Yeah.
guys also the guys libido just goes down like anayo manyinta aneda waliwo obuzibu like I don't know I can't have this conversation with her.
That's interesting, doctor, because
Yes.
some men
Yes.
can get turned off a little bit by that situation.
Exactly.
And
especially if you don't talk about it.
And then some women, no, even the fact that you have popped now, like you know, it's out there.
Yes.
Because of their obsession for sexy women and shape and size.
But some men are attracted to the pregnant women.
But what's the greatest percentage?
I don't know.
I'll tell you.
Yes.
I'll tell you.
Okay.
It is
Cancel me.
ka interest kakenderamu when you know the pregnancy is out there. But what men should know,
yes,
I'm just a father of one, is that the sex from that woman compared to when she was not pregnant is much better when she is pregnant.
Asajja mukabuliddaako. Dear parents, dear men, muwulidde. It's
so
okay.
So onyumirwa akazanyaako mulinde nga akabuto kafulumye bulungi.
Ojja kweyagala. Very good. So you can have a ticket. Yeah. Now, when should you not have a ticket to have sex during pregnancy? That is information that you get from antenatal. There's some conditions where we tell the woman, okay, first hold on to sex, and we're going to tell you first hold on for at least 2 weeks. Now, if she does not communicate this to her man, it becomes a problem back at home.
That's why the man needs to come for antenatal.
Exactly. Era wawulira mukyala nga bamugambye nti, nedda, do not do what? Do not have sex. Come with her the following day. Find out why.
Make sure it makes sense.
Yes, make sure it makes sense. Because if let it make sense, we're going to end up, because there's some women we tell, for example, she has like a threatened pregnancy loss, what we usually call like a miscarriage. We're going to give you some medicines to relax the uterus. And we don't want anything else to excite the uterus. So because sex can excite the uterus. Yeah. Okay. So we say, okay, fine, first hold on. And then first rest, first etc. When we tell her hold on, and the guy is not in the picture, the guy is like, so chichi. And then he's going to go and consult his friends. Friends are going to be like, it's okay. Like it's very okay to have sex during pregnancy. Just gala. And then there's going to become a whole thing, and then he's going to ignore the woman for all the entire time. The woman is also going to feel like something changed about me. And then when she gives birth, it becomes worse. Because there's that part where he's like, when I say, well, I don't know, you should actually tell me, by the way. Do men think about that part?
I'm not going to speak for other men. I'm going to speak for
Yes.
myself. I personally, and I've had this discussion with my girlfriend,
Yes.
that it is very important for both of us. It's not for me alone.
Yes.
And I'm glad she gets it.
Yeah.
Because some people are overly emotional about those things and they don't know these things of romance munji nyoyo. I don't know na.
I don't know.
After.
Okay.
Let me tell you, doctor.
Yes.
Your wife is pregnant. You're going for labor, right?
Yes.
And then you want your man to hold and then be there when they're pulling out the baby. But it's romantic. It will kill the man's interest in you to levels you'll never understand.
Because you're seeing whatever's happening down there.
Yes.
Now
you who thinks
it's true
that
picture
sweet,
stays in their heads.
Yes, and there's something sacred about that place for a man.
Yeah.
And there are things they shouldn't see for your own good as a wife or girlfriend.
But I'm learning.
Yes. So your desire for musajja mbererawo musajja yambereddewo yabaddewo namulabanga I was almost losing my life, but he was there holding me, my friend. That could be also the your undoing
of the relationship.
Yes,
I hear you.
So for me, I'm of the school that I need to be there when they're telling you push go yongera more and say 2 more centimeters. You know that time. Yes, that one I need to be there.
Yes.
When the doctor says now we are good to go,
it's time for the baby to pop out.
I need to step out and see you after they've cleaned her. If it's a girl, baby, I mean, and they've cleaned you, the mother of my child, and then we are normal. Because those things they're real. The percentage y'omusajja doctor atakosebwa kintu ekyo is on 0.1%.
Okay.
So 0.1%.
Baawukamu bwe tulaba mu labor ward. Abasinga nga wogambye is most of them will come and okay, so there are different kinds of men in the labor ward. There's some that come, it's first baby, they are scared. It's been a second baby, but they're still scared. Bali mu motoka. Omulyango gw'eddwaliro guyingira. Ali mu motoka, ali mu parking. Wakoma.
Nengo chimanyi.
Nengo mtaya tell you centimeter back bidi obe move what because we give birth at 10 centimeters.
10 centimeters is safe.
10 centimeters is when we push.
Okay.
So from 1 to 10 or from 0 to 10 can take a whole day or even 2 days.
I know.
So there are different kinds of men. There's that man who's going to come from the word she says I have pain. He is up in arms from home.
Yeah.
He's just scared. He's what? He's etc.
More worried than the woman.
After he's in labor.
Yeah.
He's more in labor than the woman. Abela mu motoka. Then there's a different kind of man where he comes in, like you have said, and I think that's your type, like where you come in, you're around until the point of like pushing. So that bit of a being around from like the 0 to 10, like she's going through the different phases.
Talking nice to her,
exactly.
Giving her emotional support.
Yes. Yeah. Sometimes women do not like painkillers during labor. I do not know why, but okay, she's there having labor pain and she likes you around there. Ganyaza koko rub my back, all that is very supporting, it is very helpful. Then you reach the time for labor and the man is like, doctor, thank you very much. Please let me know when everything is what? Is done. Then the different kinds of men. There's one who will come and be there. Who is going to be there even when she's pushing. Actually, he wants to be there more when she's pushing. And doctor, so how long do you think this is going to take? And I'm going, okay, this may take about maybe 10 hours. So he's like, can I go to work? And you're like, yes, you can go to work. Just make sure you talk to her. So he goes to work, he comes back, and then you're like, okay, fine. Then maybe after a few more hours later, maybe 4 hours later, it's time for pushing. He wants to be there. But he does not want to know whatever is happening down there. I think
that's doable. My problem is blood.
Your problem is
blood.
Issues with blood. That is okay because people have different phobias.
Yeah.
And that is why in antenatal, what is our birth plan? Planning about what are our preferences?
Yeah.
There's some men that want to have their baby immediately baby comes out. They want to have that. You've heard of what they call kangaroo mother care?
No.
Where what baby wateka waneno kuchifuba. So some men want to experience that as the same that my mother experiences.
At the same time.
Yeah. So like the baby has come out after coming off the mom for maybe like 5 minutes. Then the dad takes over for the next like maybe 1 hour or 2 hours.
Just laying there.
Yeah, just laying there. Some men want that. There are some men who want a photo with their woman, like after she has just given birth, that entire sweat and whatever.
And she's all fat and she's all sweaty.
Yes, yeah, because it's a reminder that this was
a hard.
Yeah, it was
fight.
a hard. Exactly. There are some men who prefer to also cut the cord of the baby. All those.
My God.
Yes. all those are plans that you make earlier before you reach there. So that woyingira yo labor ward omanyi ayandi omukyala naita kuchawa omwami yandekawo in my hardest time because they're pushing. Do you know what we usually do for young moms who are having a hard time with pushing, or even any mom that's stressed? We usually call in the guy. Because when they see the guy, there's something called the natural oxytocin. It's a love hormone. Now, the love hormone is what pushes out the baby. So, I take it, ketwongeda mu drip. Katika mu drip, which is just like a synthetic one. But they will push in the drip, and then like what it helps like increase the contractions. But we can do all that in chigana until you bring the actual person. Baby, don't you calling? And then the baby comes out, and it happens a lot, like for young parents, or they're scared, they're what, etc. And that's why we also advocate for a birth companion of choice. Ani goyagala aberewo kalamba utagenda kutia ntisagala kweyambula. And by the way, even some women should also feel that way. The same way you have said men are like this and that. There are some women who will also tell you, doctor, yes, he is here, he wants to be in here, but I don't want him in here. And you respect the decision. So you call the guy aside and say, so this is it. Olumo mubuza kono mugamba toyagala chi. I've met a mother like that. Toyagala chi nangamba sagala ndabe ngandi bwerere. I feel like I don't like my body. And I feel like I don't think I would like him to remember all this. Mugamba kali. So every time, so the guy felt left out. So what we did is that I would tell her, okay, fine, just dress up. So when he's coming in, she like gets the girl, dresses up, tumukubimeka masuka. Nanja neboge, the contractions come, but at least he got that bit of like, I was involved. Yeah. Waliwa bala abeda wonga, yena kugamba njagala abeda wanenu. So sometimes the guys are confused, like, I know. And then the other bit of Kali, omsajja wali yawo. Can I ask a question about decisions that happen during like labor? Things can change very quickly. Yeah. Nwagamba kati omanyi omwana afunye ko obuzibu. We need to go for theater.
C-section. One of the hardest conversations I've ever had as a young father. Yes. I had my first child at 27.
Wow, that was young.
Yeah. So, very scary. And what I can tell you is that there's a document you sign.
Yes.
That's the worst part.
In less than 10 minutes.
They are telling you, or to what's it called? Permission to do this, that in case anything goes wrong, you're not liable. Because that's really what is happening. And now you're just praying to Christ and saying, Father, let nothing go wrong. Yes. Because you want to make sure both the baby and the mother are coming back to you, in alive at least. Yeah. And C-section is not a good thing. Not a good thing, mostly for the mother. But you can guide me because you're the doctor. But I think for the mother... No, you are 100% right. Yes, a C-section is a life-saving procedure. Yeah. Like it is what we have to do when there is no other option. Yeah. And these people are just being like, yeah, it's okay, may I ask for a cesarean section? What are you doing? You don't know what you're trying to do. Like, the complications come with it are enormous. But and the thing is, there is no expert. Even the best doctors have lost a baby somewhere or a mother. A mother, yeah. And that is very scary. When I hear such conversations, I feel for the men out there, but I feel for the women even more. Because telling mukazi atayagala kusindika. Women today don't like to push a lot because they think pain is a pain. Also sagala. Omayirachi. Antu balongosa bulungi nnyo. Nagamba bataddeko kaggulu. Modern. Aha. Eddanga. Webalinga batunga. Ngekiwunu kiri awo kiri wekiti. Naye kati they be like, I can't even see anything. There's even no scar. But there's pain. Yeah, there is pain. It is painful. Yeah. So they have a thing of like, there is no scar. They're not going to see anything. And then they are ignorant. For them, what women think is that tugula buziwe bati. What they don't know is tugulawo. Leye soka, eyokubiri, eyokusatu, nitulega. Because we have to part these muscles that come down here. Nitulega, now that give us the 6 packs. Yeah, those muscles, we have to split them. Oh, the muscles that give you 6 packs. Splitting. Wetumala splitting. Atuyingira munda. Nitusanka wakati walina okubeera ebyenda. Usually ebyenda batebiriiwo. Olabyedanga gundi nga kiri wala. Exactly. Now that is why even in cesarean section, by the dads who enter like cesarean section, tabakiza kutunula eri.
abasinga bagwa ebiguu aganje kigenda mu maaso wane
because you see your person opened wide and
yes
you're like onagenda kumala ddewo
kyo kyennyini kati aba tamanyi kigenda mu maaso nasiza bwe babeeraga me I chose a cesarean section. What do you mean you chose a cesarean section? What do you mean? I didn't have the influence the others the wrong way. Okay, naye bannange. But tell me what goes in like in a man's mind.
Yeah.
That time when they're making a decision, there's a man I told once, and then he like sort of like sat back. Yatula nakola. He sat back. Natula what like he froze. Nemuga sebo. There's no time to wait. We have to make this decision now because the women will always say. Msajja wuuyo. Nedda, msajja wuuyo. Women are very interesting people. As long as you're there, msajja wuuno wadini. Noba toliiwo. Anti kati bangambye twayingira theatre. Mugana ibannanga obaga mubuza lumu tolina bwongo busalawo. Because you are an adult, you decide. There is no law that says that a woman should not make a decision during pregnancy. But during that time, because I think of the vulnerability and everything, she's like,
yeah, she's too vulnerable.
Exactly. She's like, wuuyo. And then this guy just goes back, yatula.
This is a very important conversation. And you know, I'm glad I'm seated here with you because I faced the worst version of all these things. Sorry. I had nobody to tell me anything. I had nobody to tell me how to treat a woman when she's pregnant. I had nobody to tell me how to treat a woman after she has given birth.
Yeah.
Early stages, 1 month, 2 months.
Yes.
Nobody.
Who did you consult?
Nobody.
You didn't ask anyone?
No, except the doctor. That's all.
So you trusted the doctors. Okay.
You sometimes some things you can't discuss with the doctor because it's a personal discussion. You think you should have someone you trust.
Like what personal discussion? There's something about gynecology. There's something about gynecology. We listen to all those personal talks.
Mwana, simanyi kyakugamba naye my status affected me also because you're so and so.
Yes.
You don't want your business
out there.
So man, it is
sort of bafuna omusawo ngaali omu
nabeera naye paka
nabeera naye paka naye omusawo waafa kati kyekibaawo wataliiwo.
But I'm older and I'm wiser and I think you cannot live this life without people.
Exactly.
Yeah, you cannot have answers to everything.
That is true.
And you can save so much time and as a man, I'm talking to the men out there.
Yes.
You can save your family, you can save yourself from the stress by agreeing to be a bit vulnerable about some things.
Exactly.
And you seek help.
In that moment, you seek help and ask the question.
Because we are all not so strong. And even if you're strong, you're not as smart.
Yes.
Some things you don't know.
But she did.
So I can never be as good as, Dr. Ruth here. So to the men, in that time, you need to know whether pregnant or after pregnancy or birth, you need support too. Yeah.
Very important.
Yeah, you need support because that's the only way you're going to understand how to support.
Can I ask a question?
Sure.
Is money enough as support?
Interesting. When I was coming here, I was thinking about a friend of mine who has this rule that my job in this is to make sure she lacks nothing during that time. From the time she says, I'm pregnant, my baby, to the time she says, we have a baby boy.
Yes.
And the day I skip work is the day she lacks something. In his mind, she may not even be lacking awetege kadda. Naye yagamba nze Katonda yantuma okukakasa nti omuntu wange talina kyakola ki? Kyalakinga.
Yes.
But kinyuma nnyo ndowooza ng'omuntu gw'oli naye akitegeera. Because the person he's with, actually sometimes amugamba leero ng'ovudde oleti genda gw'okole. Genda okole.
Kuba yategeera omuntu we.
Genda okole because ebijja mu maaso awo tukola ki?
Then
there's a friend, he's actually famous, a pastor. The wife says, no, don't come. Do God's work. Do God's work.
Go and do God's work.
I was watching one of the sermons, Apostle Grace.
Yeah.
And he's like, I've not been there for any of the children, the birth of the children too. Ne mukazi wange yangamba nti nkole ki? Nsigale ku mulimu gwa Katonda. So it depends on who you're with.
Exactly.
Because I'm sure Apostle Grace has the finances to provide. Maybe that, but maybe also understanding purpose.
Yes.
The truth is the times have changed. But the time, if we go, I'm a biblical person.
Yes.
If we go back to the times of when men were supposed to be men and women were just supposed to be women, the job of a man was to provide.
Exactly.
Unfortunately, today even women provide.
Yeah.
They contribute on provision. That is the financial side. Not unfortunately.
Yes.
Fortunately. It's not a bad thing. And then Now men have become a bit more feminine.
Oh, really?
Yes, because now they want to say, I want to be there, I want to hold your hand. Very good things.
Is that feminine?
Yes, that is tapping into my feminine, because my masculine is just
That is masculine.
no.
Okay, this argument won't end.
It won't end. Thank you. It won't
But I
end.
was asking about like the role of money, like that
Yeah,
part, like
money is
when
very
someone is
important.
making a decision
Mm,
in that moment,
yeah,
do you think about money? Like
100%.
100%. Okay.
We have to think about the money,
Yeah.
but it's also a very tight conversation
Mm-hmm.
depending on who you're with.
Yeah.
Sometimes the women we are dating want the posh treatment. I want to be in a room that is as big as our sitting room,
Very good.
where the entire clan can come and sit.
Yes.
And we have a conversation while my baby is sleeping. You understand? And that means more
money.
depending on the hospital you're going to.
Yes.
But is the man that you're married to or the father of your baby in a position to provide that?
Yes.
You know? And then after the baby is born, there are other bills that are going to come after that, just to take care of that. So
when do you think men should learn this?
Right from the day the woman says, I'm pregnant.
Thank you very much.
Yes.
As I'm yasoma. Part of birth preparedness means that you should have enough funds for your pregnancy and for what happens. What I usually tell women is that when you are pregnant, do not plan for only a vaginal birth.
Yeah.
If you choose a hospital, come about. Yes, I have this hospital that I have in mind. And by the way, women are not sick. Complication. She's just normal because pregnancy is a normal process.
Yeah.
Now, abantu atali balwadde balina obudde bungi obuyingira agamba naye kino ekizimbe kifaana bulungi so akuzaalira wano naye gwe omwami ogaba bino ddwaliro like it's a hospital ate ndabamu abalala babo bazaala naye ayina n'okugamba nedda saagadde oli nansi wabadde afaanana because she's not sick. So women are not sick. They have plenty of time to look at what is the color of the walls, what is the toilet, how does it look like. And people can actually have hospital visits. I usually tell my mothers that. We did that too. Very good. Ogendayo n'olaba. Bagenda tuyisa batya. Bwe tuyingiramu ati mu gundi mu reception. Okay, how do the people welcome us? How am I treated when I am there? How do the rooms look like? And for some hospitals they have different services. No matter price. Now what I want the men to also look at. Uva mu by'omukyala byakulaba nti room efaanana etya tunuulira price eyo. Omusajja awo tusinga okwagala okutunula. Ate tunuulira yakuzaala kusindika wokka. Mukyala n'abadde asindika. Look at the cesarean section price. Because that informs a lot of things. When you have a cesarean section price in your head, plan for that one. If she says, I want the executive, or what, VIP, rooms nazo zireso obuzibu. They are going to do the same exercise on the woman of cesarean. It's just about where she's going to be resting from. Exactly. And the money doubles. Triples. So, man. Look at the room that she's saying. If she tells you this and that, look at what is the C-section rate of this other room. That helps men calm down a lot during labor. Kubanga bakugamba nti ate kati kiganye centimeters zituuse kiganye. Ne bakugamba nti agenda musiza, you already have that plan B. If you don't have it in that moment, and maybe like most times for maybe like men that can't afford, especially like very young parents that can't afford like where to go. In that moment he's trying to call and make a decision, but for us we want to make a decision in 5 minutes, like baby's going to die, and this is a man who has to think through things like his entire life, the life of his woman, and life after birth. In just 5 minutes. Oh my God. So if he commits and says that commitment has a lot of commitment behind it. What you're planning you're saying is gonna call a cheese, gonna call a baby agenze ki ne munnasala baby omuadmiti nze onosoka nokola vote nogaa kati awo kyekyo osabe sala zotamanyi nakumanya ogenda mu nnimi n'ogenda mu Luwarabu ona n'obisaba nga abavubuka ogenda masomero basomesa especially these teenagers bagamba diapers are expensive. Very. I don't tell them the business of how much the section is. I just tell you diapers are expensive because you may think, she's just going to push. We shall just push. Okay, fine, push. Diapers are what? Are expensive. By the time you calculate all that cost, and then you say, okay, fine. By the way, the financial conversation is a very important one. Yes. And for me, I'm a bit bent on the fact that it should be 80% of the conversation. Yes. Because everything is going to take money. Kakaweka medicine, kakawe consultation. Yes. Of course, birth and everything. And then there is that first 7-8 months of
after birth.
Mhm.
Omukyala ali mu bamita post what?
Postpartum.
Those situations. How does a man deal with that situation? Because it's also very interesting.
It's part of preparedness.
Mm.
If you're going to antenatal together, or if you have a woman that comes back and tells you what happens in antenatal, and you're updated all the time, you have an expectation of planning. You go, okay, kale baganye eddagala nti tunalimira ebbanga ki lya mwezi. Then you lya mwezi oba lya myezi mwenda oba lya myezi mukaaga, different medicines for a different kind of thing. Then you know, okay. And then also understanding the complications your woman has. Someone get complications along pregnancy, just not only high blood pressure, high blood sugar.
It's a bit off topic, but still around the topic. Is there something? Can a woman have a balloon when there's no baby?
Like a tummy that is enlarged.
Like you want to be pregnant so bad that even your stomach pops.
Yes.
What's that called?
It's called pseudocyesis. So it's a condition medically, and it's a psychiatric condition where a woman really believes she's pregnant, that even her body now starts adopting like that. So she actually gets that bloated and her tummy comes out, and she even starts feeling movements of a baby. But she is not pregnant. She has never been pregnant. I have dealt with a couple like that before. I looked at the man. I felt so sorry for the man. I told him she needs psychiatric help. Because we had to counsel them differently. Like the man was very worried.
What's that?
Yeah. It's going to push the baby.
You're preparing.
At 1 a.m. in the night.
Oh my.
We're like, okay, it's not that out, just a little bit, and then we touch. What is happening here? What is the problem? She's like, some water came out. It was urine. Some water came out. We're like, okay, what is the problem? Then we do a scan. We do a pregnancy test. It's negative. We do a scan. There's a fibroid. Like, what's happening here? And then the man, he has been confused for the past 6 months. Like, this baby has been 6 months in this woman's tummy. So the man had to be cancelled differently. The woman had to be cancelled differently. Then later we put them together. And of course, they chose to first go back home. I don't know where they went. I think the woman told them they don't know what they are doing in life. But usually what happens is that they have a longing for having a child. Chivamu pressures. Family, the husband was asking for a child, and indeed they had actually sought for a child for like 8 years.
Gets the woman's head.
Exactly, gets the woman's head, and she starts like having that. I think people should know that right now, if trying to get pregnant, there's a lot of solutions in Uganda, and they're available in our own country. Yes, to get you pregnant. Like, there's some people that suffer in silence, and they don't know where to go. Maybe you're talking about like the vulnerability part of like, I don't know how to go and share my story. Go and share that fucking story with someone. Like, sorry for my language.
No, it's okay.
Just go and share the story with someone.
So you get help.
And you get help. Because the longer you take, the more your body is like, okay, you are possibly waiting for what?
I know.
Then you're going to reach a point, and then they're going to tell you, and then the things get more expensive and etc. As we are almost wrapping this up, I'm going to take us a little bit back to the conversation that we didn't finish about sex after birth. We talked about sex during pregnancy. Now, after birth, there's always that thing. If she has pushed a baby, it is important. Why are you getting too comfortable in the chair?
Because men, we need help there, man.
We need help.
Men.
So I talk about this a lot on my podcast, and I think it's also pinned up on my TikTok. And if you have had a woman and she has pushed a baby, number one is that part there, I usually call it an alien. I can't talk about in the next 1 hour, she's given birth. She's just like, you sure?
Closes.
It just closes, and you're like, but how did God make this thing?
God is amazing.
Exactly.
God understood men.
It goes back very humbly without what? Now, they're also pushing, and the woman gets some cuts down there, which usually happens. Sometimes it gets a cut, or sometimes she tears, and we have to wrap it up. Now, most times men don't know that has happened. They just know omukyala bamukozeeko
anti naddala nga bamukoze cesarean naye era byanti byasooka kugezaako kupushinga ne bigaana bugaanyi switch.
But they also have to know that yes, bamukoze cesarean, but women actually feel wide. Most women will actually share their experience and say, I just feel wide. Nemba saasindika mpulira waliwo ekyakyukamu, and that is correct. Pregnancy makes the hormone, the ligaments, all the muscles in the body relax for a reason.
So neweetamuko
omwana afulume bwatyo kirina okukolebwa. So when she tells you, yeah, I feel a little bit different, and that is why we encourage those exercises. She doesn't want to. Normally, it's okay for the first 6 weeks, but after 6 weeks, if she still doesn't feel the urge to actually have sex, dwaliro. Like quick. Yes. Dwaliro, omutwala mu ddwaliro for counseling.
From the day the baby is born.
Yes.
We are talking cesarean, for example.
Yes.
6 weeks, 1, 2, 3, 1 month and 2 weeks.
Yes, 1 month and 2 weeks.
That is serious. You're telling me that's a dire situation.
Exactly. You need to go. Yeah, because part of my job is dealing with the 1%. 1% is down here.
Yeah.
And what makes us babies is the same activity that is going to make life happy. So if by 6 weeks she is not interested, dwaliro. Togamba ntaachawona nedda. It keeps on happening. It affects them as well. Because most times they feel like, oh my God, I don't think he's ready to see what's down there. Some people have this perception of like, omwana weyayita, oba even if like I just feel like something happened. Like I just feel.
But do you see how important it is for the man to have a little bit of a distance during the birth because of this?
Well, I will not speak for the men, but I think yes.
Yes.
Yeah.
Because if this is the case in so many couples, you must know this because you're the one that is experienced.
Yes.
You'll find that bwembambadde waawo nendaba omusaayi nendaba nga bamusikayo and all that stuff. Yes, I am sweet.
Yeah.
But you might be losing me.
Now there's that kind of men and you guys are there. Waliwo abagala okubeerawo.
Yes.
Nze waliwo gwena goba kuno nimugamba ssebo eno wansi bamitolabayo nangana nedda doctor, I want to see my baby coming out. Nangana okungamba ezo nviiri za mwana nimugamba ezo nviiri za mwana. Namugamba baby, I'm seeing the head of the baby. Push.
Keep pushing.
Omwana asindika. So it's really different, like we said.
Yeah.
And I feel like that's okay. Why there's one who was there as well. The code.
Kati, so 6 weeks.
Yeah, 6 weeks.
6 assistants.
6 assistants.
From the doctors.
Exactly. From the doctors. And then if the doctors fail, get a counselor. And because there's something called sex therapy, because if it takes more than 6 months, I'll move sex counseling. Yes, go for counseling to learn how to have sex again, because it can happen. Yes, whether you have pushed, whether you have been cut. Exactly. Now what happens? What pushes the men? The men go away and then they have another babe somewhere else. And then like that thing like breaks a relationship and she keeps on feeling bad about herself, etc. But the woman will need a sex counseling. And usually sex counseling is like for 2 people. Like, there
are some superstitions where a man, the woman is pregnant and they've not been having sex for maybe 3 months. From the time you can labor wana atero kujja emyezi gibenge ebiri awo oyinza omuleka ng'otya.
What omuleka?
No.
Tomuleka. I'm speaking for pregnant women out there. As long as you're clear to have sex in pregnancy. Tomuleka. Chikole. Because we are going to tell them bagala okumenya. I think you've heard about those things. You've heard about those cultural things.
Yeah.
Bagala okumenya. What do you think kumenya is?
I don't know, but I know the
they usually take the things and what. Don't let your woman take herbs that you don't understand, because it'll affect your baby. Those will affect her. Let her take the things that we tell her medically. Now there's natural kumenya. The natural kumenya is go and have sex.
Oh.
Yeah. The trick is
like
baga kumenya magumba. Kumenya magumba, what?
So that it prepares her for
pushing. But like I already told you, pregnancy already relaxes the body for that. So if she does all that,
naturally she's built to do it.
Exactly. So if she adds on anything else that kumenyas with drugs and what, amagumba gamenyekera noddala. So onakulanga tana kugamba amagumba gandi bubi. Efe choko kugamba tugamba wanywedde mumbo anti ensoko girekerawo.
That's the problem.
Kati the natural kumenya is go and have sex. And what you talked about is very important. The conversation.
Yeah.
Have a conversation on sex. Like, what is your best position? Most women are like, doctor, which position at this point? Hey, ntekewa. Because if she lies down, she's going to feel breathless. So, like, talk to your woman. Find out about, like, what position is, like, okay. And, like, have more consistent sex. And then you even help the baby come out. Like, that is good. And when the baby comes out, but if she has those problems, and even if she's a cesarean section mom, you have to be careful a little bit. Most of them fear that the man is going to go into muchundu.
Yeah.
olwazi bamusale no waggulu totalako buzibu gyaba balowooza ekiwundu agenda kiyingira for some reason they keep thinking that kiba kimuli locked in. And I think as we conclude our session today, thank you very much.
Thank you for having me.
Wycliffe. Thank you very much for having us, having given us this entire talk and empowering the young men out there.
Yeah, man.
Banange, okubera pregnant and also giving birth is not it's not a very easy journey as many people make it seem to be. And you also need to know that you are empowered as a man to make your decisions and to also come through your antenatal period, the time for your woman when she's almost giving birth, the time when after she has given birth, like you are empowered to do so. And Uganda has also given you the guidelines to do so. You are allowed to come through, and we encourage everyone out there, please seek care. What atakedde mukyala kyakugambye during antenatal, please go
also to the men.
Yes.
To the men, it's important that you build circles that not only talk about football and all the other things.
Yes.
Sometimes the doctor knows what they're doing scientifically, but they may not know what you need as a man, and only another man who has been there might know what to tell you.
Yes.
And keep you company mentally.
Yeah.
So you need to be in the circles of men that have had children and have been through the different situations.
You should start a man antenatal. Some people have started that. Man antenatal, like a dad's club.
That's interesting.
Guys that talk about it. It's a thing now. It's a growing
sounds
movement.
Old.
Sounds old.
Like it sounds too old.
Nedda bavubuka beebuuzaako gayi nti mukyala yakugamba atya nti mama yangamba nti seetaaga naye wali ofa nti nali nfa.
That's interesting. And in this modern day we need them.
Yes, we need them. Okay, thank you very much, and see you again, and thank you. Hope you follow our pages on YouTube and TikTok, Richa Hand Uganda, Sauti Media Plus, and also at Dr. Ruth Grace. Thank you and peace out.
Cheers.
Cheers.